Venous thrombosis. Cortical vein thrombosis results in headache, seizures, and focal signs. Subarachnoid hemorrhage resulting from rupture of congested veins or extension of hemorrhagic infarction, as well as papilledema, may also occur. Superior sagittal sinus thrombosis is the most common type, and if the parieto-occipital portion is involved, may produce elevated intracranial pressure, somnolence, and cranial nerve 6 palsy. Contrast-enhanced CT scan shows a negative delta sign, which is characterized by opacification of the sinus wall with non-injection of the clot inside the sinus in only 30% of cases. MRI or magnetic resonance venography may be diagnostic. Venous phase angiography usually shows a filling defect. Other signs of parasagittal stroke or hemorrhage or both may be present because of propagation of the thrombus into surrounding cortical veins. Thrombosis may also involve the cavernous sinus, usually as a result of facial or orbital infection. Involvement is characterized by facial pain, proptosis, and involvement of cranial nerves 3, 4, 5, and 6. Superior petrosal as a result of otitis media. Facial pain is prominent. Inferior petrosal, Gradenigo syndrome with retroorbital pain and cranial nerve 6 palsy. Lateral, increased intracranial pressure and ear pain. Or internal jugular as a result of catheters or pacemakers with involvement of cranial nerves 9, 10, and 11. Vein of Galen thrombosis in neonates after trauma or infection may result in extensor posturing, fever, tachycardia, tachypnea, and death. Survivors have bilateral chorioathetosis. Causes of venous thrombosis include the following: trauma, injury, neck surgery, indwelling IV lines. Infection, middle ear, sinuses, meningitis. Endocrine, pregnancy, contraceptives. Volume depletion, hyperosmolar coma, inflammatory bowel disease, diarrhea, postpartum, postoperative. Hematologic, polycythemia vera, disseminated intravascular coagulation, sickle cell disease, cryofibrinogenemia, paroxysmal nocturnal hemoglobinuria, thrombocytosis, antithrombin 3 deficiency, and transfusion reaction. Impaired cerebral circulation, arterial occlusion, congenital heart disease, congestive heart failure, anesthesia in seated position, and sinus webs. Neoplasms, leukemia, lymphoma, meningeal spread, and meningioma. Results of lumbar puncture, if not contraindicated by mass effect, are nonspecific and may reveal increased pressure and increased levels of protein, polymorphonuclear leukocytes, if infection is present, and red blood cells, if hemorrhage has occurred. Management includes treatment of the underlying cause and supportive care. Anticoagulation therapy is usually employed if there is no major hemorrhage or bleeding disorder. Intracranial hypertension should be controlled. And that is venous thrombosis. Have a great day.